Scotty, and today I'll be doing some special tests of the shoulder. And the first one I'll be doing is the sulcus sign test. And I'm going to make sure that there's access to seeing the view of the shoulder. And I'm going to be pulling down inferiorly and make sure that the shoulder's stable. And you don't have to pull down very hard. And if a positive test would be if there's a dimple or a divot there on the side of the shoulder, and that would be a negative test. And a positive test would mean that there's inferior instability of the shoulder. And the next test I'll be doing is the Job's empty can test. And for this one, I'm gonna have you bring your arms out, deflection, your shoulders in deflection, and bring it into internal rotation of the arm and pronation of the forearm. And I wanna make sure that this is in 45-degree angle and not just in front of you. And you're gonna resist my hands. And that was a negative test. A positive test would be weakness and inability of holding his arms up. And the pathology for that would be pathology of the supraspinatus. And the next one that I'll be doing is the Hawkins-Kennedy test. And for this one, I'm going to have you bring your arm, shoulder deflection. And you want to make sure that the elbow is in the same line as the arm, and that it's not out here. And I'm going to stabilize the elbow, and I'm going to bring it into internal rotation. And do you feel anything there? Awesome. That's good. That's a negative test. A positive test would be pain. And since you don't have any pain, that's good. A positive test would also mean a pathology impingement of the shoulder. And the next test I'm going to be doing is a compression rotation test. If you can lay down for me. And I'm going to bring the arm out in a 90-degree angle. And this is, first you're going to give some pressure or axial compression on the humerus. And I'm going to bring the arm into external and internal rotation. Do you feel anything there? Awesome, that's a negative test. A positive test would be painful clicking, clacking, clunking, and that would also mean that it would be a possible labral tear for the pathology. That's it for me.
Okay. Hello, I'm Elizabeth, and today I'll be doing 4 special tests for the shoulder. The first test that I'll be doing is the apprehension test. I'll have Scotty lay down on his back. And this test is used to determine if there's any anterior instability of the shoulder. And so what I'll do is I'll have move his shoulder into abduction, and then I'll move into external rotation. And if there's any apprehension, that would be a positive test. The next test that I'll be doing is the bear hug test. So for this test, we'll have the patient bring their involved arm up like this, and you'll try to keep your elbow up and your hand on your shoulder while I try to pull your arm up and away. So resist. Okay, perfect. Then a positive test for this test would be if they're unable to keep their arm on their other shoulder, or if there's weakness when we compare bilaterally.
This test is used to determine if there is subscapular weakness.
So Scotty here had a negative test. So the next test that I'll be doing is called the SPEEDS test. And this test is used to determine if there is a biceps or labral pathology. And so I'll have them bring their arm straight out, and then I'm going to have you lift up, and I'm going to resist that motion. Perfect. And so a positive test for the SPEEDS test would be if there's any pain associated with the resisted shoulder flexion. Did you have any pain when I did that?
A little bit.
Okay, so that could indicate a positive test for the SPEEDS test. The last test that we'll be doing is called the crank test. So I'll have you lay on your back again. And this test is used when a labral tear is suspected. And so we'll have them bring their shoulder into the scapular plane, so about 160 degrees. We'll apply an axial load through their humerus, and then we'll move through rotation. And then if there's any painful clicking when we're moving through the rotation, that would be a positive test. Is there any pain?
Nope.
Okay, perfect. So that would be a negative test, and those are all of the tests that I'll be doing.
Dr. Slaughter, my name is Camden Jones. And I got my nice polo, got my slides, and my subject, Elizabeth. We're gonna be doing some special tests of the shoulder for you today. We're gonna start off with the anterior drawer test of the shoulder. Elizabeth, can you lay down for me?
Okay.
We're gonna be testing to see if there's a glenohumeral joint instability or a possible labral tear. We're gonna be doing this by pulling the arm out to about 90 degrees. And then we're going to be giving some anterior translation of the glenohumeral joint, being careful not to also translate the scapula. If there is a sharp or a clicking pain that is associated with that, that would be an indication of a positive test and a potential glenohumeral joint instability or labral tear. The next test that we're going to be doing is the shear test. Go ahead and sit up. The shear test is going to be testing to see if there is it's doing something. That shear test. It is, hold on, I can figure it out. The AC joint sprain. Alright. We're going to be doing the shear test, which can indicate a potential AC joint sprain. That'll be our second test. And to do this test, we're going to be applying pressure to both the clavicle and then the spine of the scapula. So I'm going to go ahead and just come in, give a little bit of pressure right through here. As we give this pressure, if there is laxity or pain associated with that, that could indicate that there is a positive test or an AC joint tear or sprain. The last test that we're going to be doing is the infraspinatus strength test. For this test, we're going to bring the patient bring their arms into 90 degrees, and we're going to have them resist pressing in, so they're going to be pressing out, making sure that they don't flare their elbows. If there is elbow flaring, you can do it unilaterally instead of bilaterally to ensure that that elbow does not move. The infraspinatus strength test, if there's weakness associated with that, especially when compared bilaterally, that can just indicate that there is weakness within the infraspinatus.